GERD is gastroesophageal reflux disease. It affects 30% of general population. In pathophysiology or causes, there is abnormality of lower esophageal sphincter, hiatus hernia, delayed esophageal clearance, delayed gastric emptying, increase in intra-abdominal pressure, and others are dietary fat, chocolates, alcohol, tea, and coffee. These relax lower esophageal sphincter of esophagus and provoke symptoms. Clinical features may heartburn, regurgitation, often provoked by bending, straining, or lying down, water brash. This is reflex salivary gland stimulation as acid enters a gullet. Patient is overweight. Some patient wake at night by choking, odynophagia, painful swallowing, dysphagia, difficulty in swallowing, atypical chest pain which may be due to esophageal spasm, hoarseness, it is acid laryngitis, asthma, recurrent chest infection, chronic cough. अब इसको इन्वेस्टिगेट कैसे करेंगे? इसमें सबसे पहले कराते हैं एंडोस्कोपी. दिस इज इन्वेस्टिगेशन ऑफ चॉइस. देन मैनोमेट्री, बेरियम swallow, 24-hour pH monitoring, impedance testing. Endoscopy is investigation of choice, and 24-hour pH monitoring is more sensitive and specific, and it is gold standard. If pH is less than 4 for more than 6 to 7% of study time, then it is diagnostic of GERD. Manometry, if motility disorder suspected. Barium swallow to rule out carcinoma, and it identify complications but not GERD. Impedance testing can detect weakly acidic or alkaline reflex that is not revealed by standard pH testing. And now how it would be managed. First of all, lifestyle modification in this: weight loss, avoid dietary items, elevation of bed head, avoidance of late meal, smoking cessation. In medical treatment, proton pump inhibitors, ACE2 receptors antagonist, antacid alginates. Proton pump inhibitor relieve symptoms and heal esophagitis, but ACE2 receptor antagonist relieve symptom without healing. If PPIs are used for prolonged period, they decrease the absorption of iron, vitamin B12, magnesium, small but increased risk of osteoporosis and fracture, predispose enteric infection with Salmonella, Campylobacter, Clostridium difficile, H. pylori associated gastric atrophy. These are the complications of PPI. In surgical treatment, laparoscopic anti-reflux surgery is performed, which is fundoplication. There are two types: Nissen fundoplication and partial fundoplication. Complication of fundoplication is inability to vomit and gas blood syndrome. Now, complications of GERD are esophagitis, Barrett's esophagus, anemia, benign esophageal stricture, esophageal ulcer, recurrent pneumonia, dental erosions, gingivitis, laryngitis, pharyngitis, esophageal carcinoma, and gastric volvulus. In the benign esophageal strictures, there is dysphagia for solids more than for liquid, and it is managed by endoscopic balloon dilatation or bouginage. In the Barrett esophagus, this is pre-malignant lesion. It is diagnosed by multiple systematic biopsies and treated by radiofrequency ablation or photodynamic therapy. If dysplasia is high grade, then esophagectomy or endoscopic resection is done. Barrett esophagus is associated with smoking but not alcohol. That's all.